Good day, and welcome to another HIMSS TV Digital Checkup. I'm Bill Sawicki, Features Editor of Healthcare IT News, a HIMSS Media publication. Today we'll be talking about how the pandemic has accelerated the adoption of value-based care models, why the amount of time it takes for a patient to get transferred from a community hospital to a specialty center for certain types of care can ultimately affect outcomes, how IT can help in these areas, and much more. My guest is Dr. Darin Vercillo, Chief Medical Officer and co-founder of Central Logic, which provides software and strategic guidance to health systems to orchestrate operations, including patient transfers and discharges to post-acute care. First, Darin, you have said that the pandemic has accelerated the adoption of value-based care models and that technology can help C-suite leaders improve metrics such as average length of stay, which can help them get back into the black following the economic fallout of the pandemic. I'm hoping you can elaborate a little bit on this.
You know, looking back over the past year to year and a half, certainly the pandemic has been a catalyst for many different areas of learning. You know, we've seen so many challenges in how healthcare systems are having to do business with their hospitals, their post-acute care offerings, their ambulatory arena, surgical centers, you name it, visiting, nursing, and so on. These past 18 months really have seen drops in ER volume, drops in surgical volume, strains on infrastructure and nursing resources, and have forced healthcare leaders to step back and look at how they do business and question some of the models that they've been following over the years. They've been asking, how are we going to address these issues? And how are we going to run healthy businesses in spite of these issues? And of course, any decisions that are made can't compromise quality of care. That always has to be paramount. So, you know, even prior to the pandemic, forward-thinking leaders in healthcare systems were already addressing or thinking about many of these issues. They were adopting more comprehensive risk models with ACOs and community and employer partnerships. They were broadening and diversifying their offerings through mergers and acquisitions and so forth, and growing new services. You know, they were really looking for actively to keep patients within their organizations throughout the entire cycle of patient care, which includes wellness and ambulatory, you know, as hospitalizations as well when necessary, and post-acute care and other areas. Ultimately, they didn't and don't want to leave to chance that a patient might exit their network and go seek their care and business elsewhere at some point along the way. So this really has given birth to the whole access and orchestration strategy. Rather than the traditional method, which I like to call it, if you build it, they will come, this strategy takes a proactive approach to, as you mentioned, interfacility transfers, ambulatory care, surgical referrals, which many hospital and healthcare CEOs are really trying to wrangle and wrap their minds around, as well as post-acute care placement and more. And at the heart of this strategy is the Access and Orchestration Center. This is really where the execution takes place. It brings together people from all areas of the healthcare system, including nursing and interfacility transfer, transport and post-acute care placement, data and IT, as well as case management, social work, and more, and puts them all in a highly technologically connected environment where they can operate in an optimal and efficient way. And really, by doing this, they can address all of these issues and place patients where they need to be, reduce length of stay, reduce readmissions, and optimize the business of the healthcare system. And this is what we do at Central Logic. We bring in the technology and the process to lay the groundwork for this access and orchestration strategy and execute on it as well by putting in a platform that creates connectivity from other systems, as well as provides the tools to address these issues and the visibility into the data to execute on this as well.
The amount of time it takes for a patient to get transferred from a community hospital to a specialty center for certain types of care can ultimately affect outcomes and other metrics, such as future emergency department visits, rehospitalizations, and average length of stay that drive healthcare costs. So how can technology help expedite that access to the right level of care when patients need it most?
Bill, optimizing the process of interfacility transfers really is a trifecta of improving patient care, provider relationships and satisfaction, as well as improving the business, both top line and bottom line, for the hospital and healthcare system. This is what we've been doing at CentralLogic for a decade and a half. And we've seen improvements in speed to care, overall outcomes for patients, as well as growth with our partners that we've been working with. The goal of an interfacility transfer, going back to what you mentioned as far as the speed is concerned, is to get the patient to the right level of care at the right time without delay. And you hear such sayings as, for example, time is brain and time is myocardium. And the truth is, whether it's a stroke that needs a thrombectomy or a STEMI that needs an intervention, or if it's trauma or sepsis or any other kind of reason that somebody has been transferred, we can handle those transfers in an optimized way with dedicated technology that addresses issues such as selecting the right provider or the right location, using scripts and algorithms that optimize that time to decision making. We also can improve things such as records transfer across organizations, making sure that the teams that are going to take care of those patients are ready ahead of time to address those patients' needs by knowing about them better. And we view this as combinations of technology and interconnectivity that exists there in the Access and Orchestration Center to address the needs of transfers. But beyond that, by putting on top of that best practices and processes that allow the transfer or the Access and Orchestration Center to function in an optimized way, then all of those things are handled in a standardized fashion and create valuable data from those experiences as well, allowing hospitals and healthcare systems to predict what's going to go on in future transfers, as well as to support and substantiate the decisions that they make along the way. Now, in addition to all of that, in addition to the technology that's used, in addition to the best practices as well, we put into practice things such as a provider engagement program, which engages with providers and gets them aligned to the initiatives of the healthcare organization and reduces barriers to decision making. As we look at transfers in all of their different aspects, decision to who the provider is going to be, how the patient is going to be transported, getting that transport in place, getting the patient to the definitive endpoint of care. To your point, we can shave off 30, 45 minutes, even an hour off of that transfer process time, so the patients get there more quickly and get their definitive endpoint of care or intervention more quickly as well, maximizing their optimal outcome.
On the other side of the acute care journey, ensuring smooth transitions of care from acute to post-acute care is essential to decrease average length of stay. You said that newer technologies and community networks with post-acute care are improving that discharge time from days to hours. Please explain that.
As we dealt with the pandemic, we saw that the impact that it had in the ability to move patients from hospitals to a post-acute care setting in a timely fashion really totally broke down. We dealt with issues such as highly variable testing requirements, a reduction in the number of skilled nursing facilities available to transfer patients to because of COVID cohorting and many other issues. And some patients were delayed many days in being transferred from the hospital where they had already met discharge criteria, then to the post-acute care facility where it was desired to transfer them to. And this resulted in bottlenecks that went upstream from there too, such as patients being left in the hospital, so fewer numbers of beds, and fewer numbers of beds, so bottlenecking in the ERs as well. This really further highlighted the need to improve communications and decision-making when discharging patients from hospitalizations to post-acute care. You're probably familiar with the current process. Case managers and social workers making innumerable phone calls, standing in front of fax machines and inserting reams of papers to all the different post-acute facilities that are being considered for transport or transfer of the patient. It's almost comical to think about in this age It's tragic, really, but it is what many organizations face and do on a day-to-day basis. Instead, being able to automatically identify the appropriate skilled nursing facilities that match the patient's needs, whether it's dialysis or level of care or their insurance requirements or even geography, being close to family. And then being able to automatically and electronically transmit the most accurate and current information about the patient without standing in front of a fax machine. And then ultimately being able to make that decision of where the patient will transition to for the next leg of their journey is why we at CentralLogic partnered initially and then ultimately acquired a company called EnzoCare, which is a curated, connected network of post-acute care facilities and hospitals. And by being able to automate all of those things that I just talked about, creating connectivity and improving the relationships between the hospitals and the post-acute care providers through this network, this cuts hours off, even a day if you get the patient then discharged in a timely manner so they don't have to be held over to the next day, improves nursing resources and frees them up to care for other patients instead of having to just watch those patients while they make decisions. And then ultimately what we saw in the pandemic as well is it could cut multiple days off of their stay by getting them to a post-acute care facility in a timely manner by leveraging this network and these capabilities. And again, this is all part of a comprehensive access and orchestration strategy, a strategy that really needs to be adopted by every healthcare system that transitions patients throughout this entire cycle of care. And as I mentioned before, as proactive and forward-thinking healthcare leaders think about how they're going to diversify their systems, grow new services, not only own hospitals, but acquire and partner with ambulatory care centers, acquire post-acute care centers or have highly affiliated relationships with them. Managing these things proactively becomes an imperative on the strategic list.
How are hospitals using technology to get patients not just to post-acute care more quickly following discharge, but increasingly to extended behavioral health care, which is an issue that is receiving more attention in light of increased behavioral health issues due to COVID-19?
This area, in my mind, really highlights the social disparity and, quite frankly, is a social determinant of health in a high-risk population that traditionally has not had adequate access to resources that they've needed. And so, as we look at, as you mentioned, interfacility transfers, or as we look at post-acute care placement, we have a tremendous amount that we can learn about how we're effectively managing those things and apply those to behavioral health transfers, and then also helping to manage behavioral health patients' care after they leave the hospital and even after they leave post-acute inpatient psychiatric care as well through this access and orchestration strategy. Traditionally, finding resources for behavioral health patients, especially as they transition out of a healthcare environment such as a hospital, has been very difficult. Visibility into the resources where these patients can be placed has been minimal, if not non-existent. And the relationships with where those patients can get those resources or get that care has oftentimes been through 2 or 3 levels of separation, going through other parties or other services. And again, that makes leveraging this that much more difficult because we can't build up those persistent relationships that allow us to help make those decisions on behalf of the care of these patients. And then ultimately, as those patients transitioned from hospital to perhaps inpatient or outpatient psychiatric care, then they started to slip through the cracks and get lost to the transitions of care. As we oftentimes see, those are some of the most dangerous parts of any patient's journey is in those transitions. And so with a more comprehensive access and orchestration strategy in place, what healthcare systems are doing now is they are creating more persistent relationships and visibility into where there are behavioral health beds available for inpatient care coming out of a hospitalization. And so knowing that, they're able to make calls to the appropriate people and get those patients placed in a much, much more quick and efficient manner. Additionally, since these patients are oftentimes part of an ACO, or they may be part of an employer risk agreement that a hospital or healthcare system has, the Access and Orchestration Center is then being leveraged to contact those patients, reach out to them, reduce recidivism, reduce readmissions, and as I mentioned before, slipping through the cracks by keeping contact with them. This, of course, can reduce cost, as it can in any situation where you're reducing readmissions. It also keeps a better quality of life in place for behavioral health patients who sometimes, because of compliance issues, lose contact with their providers. But with outreach and with better orchestration of their care, we improve compliance, improve follow-up, and keep them happy and at home where they can live their lives in greater comfort and reduce their ongoing utilization of their healthcare system. So again, it's really part of this strategy of bringing the right people together, technology that can be used for things such as managing records, outreach and communication, and identifying people who need that more personal touch to make sure that they're successful in their patient journey.
Well, that's today's digital checkup. I'd like to thank our guest, Dr. Darin Vercillo, the Chief Medical Officer and co-founder of Central Logic. Thank you, Darin. And HIMSS TV viewers, stay tuned for another digital checkup coming soon.